55-year-old David was just like you. He got regular checkups. His EKG was normal, his blood work looked good, and his doctor was pleased. But David's arteries harbored a deadly secret. Only one technology could see it. Could there be a hidden danger lurking in your arteries too? David Richardson embodied everything doctors love to see in a patient. At 55, this Seattle-based marketing executive had been getting annual physicals for the past decade. He exercised regularly, maintained a healthy weight, took his blood pressure medication as prescribed, and had never smoked. His wife Karen often joked that David was more consistent with his medical appointments than with remembering anniversaries. Every year, the routine was the same. Blood work at the lab, a stress test at the cardiology office, an EKG, and a sit-down with Dr. Patricia Williams, his longtime family physician. And every year, Dr. Williams would smile and deliver the same reassuring message. Everything looks great, David. Keep doing what you're doing. But in March 2023, everything changed. Not because David's routine tests showed problems, but because Dr. Williams suggested something new. David, I want to talk to you about something, Dr. Williams said during his annual appointment. Your EKG is perfect, your stress test is normal, and your blood pressure is well controlled. But I've been reading about new developments in cardiac imaging, and I think we might be missing something important. David was puzzled. Missing something? But you just said everything looks great. Dr. Williams pulled up David's EKG on her computer screen. This EKG tells us your heart's electrical system is working perfectly. The stress test shows us that when we make your heart work harder, it responds normally. But neither of these tests can tell us what's happening inside your coronary arteries. She drew a simple diagram on her prescription pad. Think of your heart like a house. The EKG is like checking that all the electrical wiring is working. The stress test is like making sure the lights turn on when you flip the switches, but neither test tells us if there are cracks in the foundation. David, heart attacks don't happen because your EKG is abnormal, Dr. Williams continued. They happen when fatty plaques in your arteries rupture and form blood clots. These plaques can be building up for years without causing any symptoms or showing up on routine tests. David leaned forward, suddenly very interested. So you're saying I could have these plaques and not know it? Exactly. In fact, this is incredibly common. We see patients all the time who have normal EKGs and stress tests, but significant plaque buildup in their arteries. The scary part is that the first symptom of serious heart disease is often the heart attack itself. Dr. Williams showed David a medical journal article on her tablet. Look at this study. It found that nearly 50% of people who have heart attacks had normal stress tests within 2 years before their attack. The traditional tests we've been relying on simply aren't designed to detect early plaque formation. So what do you recommend? David asked. I want you to get something called a coronary CT angiogram, what we sometimes call a virtual angiogram, or cardiac CTA. It's a revolutionary imaging technique that can actually see inside your coronary arteries without invasive procedures. Dr. Williams explained how the technology worked. Instead of threading a catheter into your heart, like in traditional angiography, this uses advanced CT scanning with contrast dye. The entire procedure takes about 2 to 3 minutes, and it gives us incredibly detailed images of your coronary arteries. She pulled up sample images on her computer. Look at this. We can see the arterial walls, measure the thickness of any plaques, and identify areas where blood flow might be compromised. It's like having X-ray vision for your heart's blood supply. David was hesitant. But Dr. Williams, if my EKG and stress test are normal, do I really need this? It sounds expensive. Dr. Williams understood his reluctance. David, I get it. And you're right that this isn't typically covered by insurance as a screening test. But let me put this in perspective. If you had significant plaque buildup, wouldn't you want to know about it before it causes a heart attack? She shared more sobering statistics. The thing about heart attacks is that they're often the first and final symptom of coronary artery disease. About 25% of heart attacks are fatal. But if we can identify significant plaque before it ruptures, we can take aggressive preventive measures. What kind of preventive measures? David asked. Depending on what we find, we might intensify your medications, recommend more aggressive lifestyle changes, or in some cases, preventive procedures. The key is catching problems while they're still manageable, not after they've become life-threatening. 2 weeks later, David found himself at Seattle's Advanced Cardiac Imaging Center. The technologist, Maria, explained the procedure as she prepared the IV line for contrast dye. Mr. Richardson, this is going to be quick and painless. You'll lie on this table, we'll inject the contrast through your IV, and the CT scanner will take images of your heart. The whole thing takes about 3 minutes of actual scanning time. As the scanner hummed around him, David wondered if he was overreacting. His EKG had been normal. His stress test showed no problems. Maybe Dr. Williams was being overly cautious. But when Dr. Sarah Chen, the radiologist, called Dr. Williams with the results 2 hours later, David's perspective changed forever. "David, I need you to come in immediately," Dr. Williams said when she called that afternoon. "We need to discuss your CT angiogram results." The urgency in her voice made David's stomach drop. "What did you find?" "I don't want to discuss this over the phone. Can you be here in an hour?" When David arrived at Dr. Williams's office, she had his images displayed on her large monitor. What he saw changed his understanding of his own health forever. "David, this is your left anterior descending artery. We call it the LAD. See this area here?" She pointed to a section of the artery that appeared narrowed and filled with what looked like white calcified material. "You have a 75% blockage in what we call the widowmaker artery. This plaque is extensive, calcified, and critically dangerous. If this had ruptured and formed a clot, you would have had a massive heart attack." David stared at the images, stunned. "But my EKG was normal. My stress test was normal. How is this possible?" Dr. Williams explained the limitations of conventional testing. Your EKG measures electrical activity. Until an artery is completely blocked and heart muscle starts dying, the electrical system often continues working normally. Your stress test evaluates how your heart responds to increased demand, but a 75% blockage can still allow enough blood flow during a standard stress test to appear normal. She showed him comparison studies. This is why we're seeing a revolution in cardiac care. Traditional testing was designed to detect heart attacks after they have already started, or to identify severe blockages that are already causing symptoms. But by then, we're often too late for optimal prevention. The coronary CT angiogram shows us the arterial walls themselves. We can see plaque formation years before it would show up on an EKG or stress test. It's like the difference between looking at a house from the outside versus having blueprint access to every room. The discovery of David's hidden blockage triggered an immediate and aggressive treatment protocol. Dr. Williams referred him to Dr. Michael Torres, an interventional cardiologist. "David," Dr. Torres explained during their first meeting, "finding this now, before you've had symptoms or a heart attack, puts us in the best possible position to prevent a cardiac event." The treatment plan was comprehensive. "We're going to start you on high-intensity statin therapy to stabilize and potentially shrink these plaques. We're adding a blood thinner to reduce clot formation risk. And I want to see you back in 6 months for a repeat coronary CTA to monitor our progress." Dr. Torres also emphasized lifestyle modifications. "The imaging shows us where you are now, but your future depends on how aggressively we can slow or stop plaque progression. This means optimizing your diet, exercise, stress management, and ensuring perfect medication compliance." 6 months later, David returned for his follow-up coronary CT angiogram. The results were remarkable. "David, look at this," Dr. Torres said, displaying the new images alongside the original ones. "The plaque burden hasn't increased, and in some areas, we're actually seeing stabilization and even slight improvement. More importantly, there are no new areas of concern." But the real validation came when Dr. Torres showed David what conventional testing would have revealed during this same period. "We ran an EKG and stress test alongside your CT angiogram. Want to guess what they showed?" David smiled grimly. "Let me guess. Completely normal?" Exactly. If we had continued relying on traditional testing alone, we never would have identified this life-threatening condition. You would have remained a ticking time bomb, feeling perfectly healthy right up until the moment of a potentially fatal heart attack. David's case became a teaching example at Dr. Williams's practice. She began recommending coronary CT angiograms for more of her patients, particularly those over 50 with risk factors, regardless of normal conventional test results. David's story illustrates a fundamental shift in cardiac care, she explained to other patients. We're moving from reactive medicine, treating heart attacks after they happen, to truly preventive medicine, identifying and treating arterial disease before it becomes life-threatening. The technology also revealed important insights about plaque formation and heart attack mechanisms. What we've learned is that heart attacks don't usually happen from the most severely narrowed arteries, Dr. Torres explained. They often occur when smaller, softer plaques rupture unexpectedly. The coronary CTA can identify these vulnerable plaques years before conventional tests would detect any problems. The experience transformed David's relationship with his health. I used to think I was doing everything right because my tests were normal, he reflected. Now I understand that good health requires much more proactive monitoring. David became an advocate for advanced cardiac imaging among his friends and colleagues. I tell everyone, if you're over 50 and have any risk factors, ask your doctor about coronary CT angiography. Don't assume that normal EKGs and stress tests mean your arteries are healthy. His wife Karen was equally affected. David looked and felt completely healthy. If we hadn't done that scan, we never would have known about the time bomb in his chest. It's terrifying to think how close we came to losing everything. Dr. Chen, the radiologist who interpreted David's scans, emphasized both the power and appropriate use of coronary CT angiography. This technology is revolutionizing cardiac care, but it's not for everyone, she explained. It's most valuable for people like David, those with risk factors but no symptoms, where we need to look beyond what conventional tests can show us. She also stressed the importance of proper patient selection. The radiation exposure is minimal but not zero. The contrast dye carries small risks, and false positives can lead to unnecessary anxiety and procedures. But for the right patients, this technology literally saves lives by detecting disease years before it would otherwise be found. David's story represents a broader trend in medicine toward personalized precision healthcare. We're moving away from one-size-fits-all testing toward individualized risk assessment, Dr. Williams explained. The coronary CT angiogram is just one example of how technology is allowing us to see diseases earlier, treat them more effectively, and prevent catastrophic events like heart attacks. Dr. Torres added, 5 years ago, David would have been considered a perfectly healthy patient right up until his heart attack. Today, we can identify his risk and intervene aggressively to prevent that heart attack from ever happening. Today, 3 years after his diagnosis, David remains heart attack-free. His follow-up scans show stable, well-controlled plaque. His story has influenced dozens of his friends and colleagues to pursue advanced cardiac imaging. The lesson isn't that everyone needs a coronary CT angiogram, David emphasizes. The lesson is that we can't assume normal routine tests mean we're safe from heart disease. Technology exists to see what conventional tests miss, and for people like me, and maybe like you, the technology can be the difference between life and death. David's experience illustrates the fundamental limitation of traditional cardiac testing and the revolutionary potential of advanced imaging. While EKGs measure electrical activity and stress tests evaluate heart function under demand, only direct arterial imaging can reveal the fatty plaques that cause most heart attacks. Think of it this way, David often tells people. An EKG is like checking if your car's dashboard lights are working. A stress test is like seeing if the engine runs when you press the gas pedal. But coronary CT angiography is like actually looking under the hood to see if there are problems that haven't caused symptoms yet. The technology that saved David's life continues to evolve, offering hope for countless others who may be walking around with hidden arterial disease, feeling perfectly healthy while harboring potentially lethal plaque in their coronary arteries. As David concluded in a recent talk to his local community group, "I thought I was taking good care of my health with regular checkups and normal test results, but I learned that sometimes taking good care of your health means looking beyond the tests that tell you everything is fine and embracing the technology that can see what those tests cannot. In my case, that technology didn't just change my medical care, it saved my life." The months following David's diagnosis brought unexpected challenges that tested not just his physical health, but his entire approach to life. As news of his condition spread through his circle of friends and colleagues, David found himself becoming an unexpected advocate for advanced cardiac screening. "Seeing David's experience probably added 10 years to my life," Mark reflected. "I had no symptoms, perfect blood pressure, and I run marathons. I never would have suspected anything was wrong. But the scan showed early changes that we can now address before they become dangerous." This ripple effect extended to David's workplace. As a senior executive, David shared his story during the company's annual health fair. The response was overwhelming. 12 of his colleagues requested information about advanced cardiac imaging, and 6 actually underwent the procedure. 2 were found to have significant blockages requiring immediate intervention. Dr. Chen, the radiologist who first interpreted David's scans, began tracking these referral patterns. "What we're seeing is that when someone like David, a respected professional who appeared perfectly healthy, shares their story, it creates awareness that can literally save lives throughout their community." This creates a troubling disparity, Dr. Williams noted. The patients who could most benefit from early screening, those with multiple risk factors but limited resources, are often the least likely to receive it. We're working with insurance companies to recognize that preventive imaging can be far more cost-effective than treating heart attacks. David's story also contributed to changing protocols at his medical practice. Dr. Williams began offering coronary CT angiograms to all patients over 50 with any cardiac risk factors, regardless of their conventional test results. The practice saw a 300% increase in early detection of significant coronary disease. 1 year after his diagnosis, David received news that validated every aspect of his experience. A large-scale study published in the American Journal of Cardiology showed that coronary CT angiography reduced heart attack rates by 41% in patients similar to David, those with risk factors but normal conventional testing. David's case represents the future of cardiac care, Dr. Torres explained. "We're moving from a system where we wait for heart attacks to happen and then treat them, to a system where we identify disease early and prevent heart attacks from ever occurring. The technology exists, the evidence supports it, and patients like David prove that it works." Today, David carries a small card in his wallet with before and after images from his coronary scans. He shows it to friends, family members, and anyone who will listen. The message is always the same. Normal EKGs and stress tests don't guarantee healthy arteries, but technology exists to see what those tests cannot. His final advice is simple but profound. Don't wait for your heart to tell you something's wrong. By then, it might be too late. The technology to see inside your arteries exists today. It saved my life, and it could save yours too.